obviously that's going to put even more pressure then on the pelvic floor muscles. So the pelvic floor, what is the pelvic floor? The pelvic floor is muscle. It's fascia that connects everything together. There are nerves. And we've talked about this in terms of childbirth, where at the very end, the baby pressing down on the pelvic floor sends a signal through those, from the brain, right, through those nerves, to release more oxytocin. Remember we talked about this? So that pressing down is what makes transition so hard. At the very end, when there's a lot of oxytocin being released during transition, that makes the uterus contract even more often and more powerfully. So the pelvic floor is like a sling that attaches from front to back, pubis to tail, and along the inside of the pelvis, sit bone to sit bone. And there are 3 layers of pelvic floor, right? And so you have a picture here on page 17. There are 2 parts. The first part is the urogenital triangle, which is that top part that's in the lighter color, and it's more superficial or closer to the outside of the body. And then you have the anal triangle, which is the deeper layer of muscle. And there are 3 layers that we're going to talk about and that we're going to experience. And we're going to do a lot of pelvic floor work tomorrow where you actually experience these layers. But the first layer is the PC muscle, that is that figure 8 muscle that wraps around the female genitals, including the clitoris, the vagina, and the urethra. And it figure 8s around the perineum and surrounds the anus. The second layer are the transverse perineals, which go from sit bone to sit bone. So you can see them right on your picture. See them? They go right across. So the first 2 layers are crisscrossing at the perineum. Think about how important the perineum is in yoga. It's the site of the Lavanda. It's the site of the first chakra. So from a subtle body anatomy perspective, it's also a really important part of the anatomy. And then from a Western anatomy perspective, it is the exact spot where those first 2 layers crisscross each other. But the most important layer is the 3rd layer, because it's the deepest layer, and it's the layer that supports the pelvic organs, including the bladder and the uterus, and the urinary tract and the digestive tract. And that is the levator ani, and that is going from pubis to tail, and it's a lot wider, so it's sort of encompassing the whole bottom of the pelvis. And that's what you are, when we talk about supporting the organs, we're really talking about that 3rd layer. And when we talk about Kegels, to Kegel, not to Kegel, if we do Kegel, how to Kegel, we're talking about specifically the place where the first 2 layers cross, the perineum, and we're talking about that 3rd layer of pelvic floor that's very deep into the body. The first 2 layers are going to be a little easier to feel, and then it gets harder, just like it's harder to feel the psoas because the psoas is so close to the body. It's a little harder to feel the 3rd layer. There are fast twitch and slow twitch muscles, and so that's why it's important to work to work the pelvic floor quickly, and also to work it slow and build endurance. But one of the things that we're going to talk about is how important it is to have a long pelvic floor. So if my pelvic floor is short and I try to contract it, you might get a little bit of contraction out of it, but you're not going to get a lot of contraction out of it. That's why strengthening a shortened muscle is not going to make that muscle very strong. The way that we can build strength is to elongate the muscle, and then the muscle has the ability to contract because it's already in a normal position. So the first piece of any kind of pelvic floor discussion is how important it is to have a long pelvic floor. I think in our culture we have a very shortened pelvic floor because we sit. So especially if I'm sitting like this, I'm bringing my tailbone and my pubic bone together and I'm shortening my pelvic floor. So it's impossible to get away from. I know I'm talking to a lot of yoga teachers who probably have better posture than the average, but we all have to sit. We sit at desks. I drive in a car a lot, which forces me to sit in that shortened kind of position for the pelvic floor, and it's almost impossible to get away from. So one of the ways that you can stretch the pelvic floor, elongate the pelvic floor, is to squat. So if I squat, if I sit like this, right, I am elongating the pelvic floor. And when I elongate the pelvic floor, I'm making it more taut, since it's like a trampoline, and that's going to then press up against the internal organs, creating a lift for them. The other thing is, when I squat, or if I stand just with good posture, with my pelvic floor, not so much as a floor, but a little bit further back behind me, more as a back wall, then the organs are not going to be sitting, the female reproductive organs are not going to be sitting right on the pelvic floor. They're going to be sitting slightly anterior to it over the pubic bone, and that's going to be more supportive than that wall of muscle. It wasn't meant to be underneath us, right? It's meant to be more like a back wall. That might be sort of an exaggeration, but it's somewhere between a floor and a back wall. So the organs are not sitting right on top of the center of the pelvic floor, but more on the anterior portion and over the pubic bone. Yep, making sense?
So that's why most women have anterior pelvic tilt?
That's exactly right. So when we went from being upright to, from being all fours to upright, we didn't go up from the pelvic floor, right? We went up from the low back. So the pelvis, when you're on all fours, is in an anterior tilt. So we just went up from the low back. That's why you have that curve in the low back, right? Your pelvis is still in an anterior tilt. So when you look at a picture of a pelvis from a head-on view, straight, from looking at it from a straight-on view, almost always, even in anatomy books, you're really looking at a pelvis that's in a tucked position if you're looking straight at a pubic bone. If you're looking at a pelvis that is in a tadasana, right, to use a yoga term, or an anatomically correct position, you're really looking down through it, right? You're not looking straight at it. And so because the pelvic floor is tilted, so you'd be looking down into it. So you know how you don't hear it as much anymore because it's just not anatomically correct, which is why I think we've gotten away from it as a yoga community. But for a long time, we would talk about the pelvic bowl, right? As the pelvis as being a bowl and like holding your soup, so that you would not want to spill your soup either forwards or backwards, and to kind of hold your soup in your pelvic bowl. But it wasn't really anatomically accurate, which is why I think you don't hear it as much, because your soup should always be spilling out the front. Does that make sense? Right? Your pelvis is when it's in anatomically correct position, it is in a slight anterior tilt. So your soup is spilling forward, so that you have a curve in your back. If I hold my soup in and I bring my pubic bone up, right, then I'm in a tucked position with the rounded spine, which is the problem. Most of us sit like this all the time, and we end up having flattened low back and a lot of pressure down on the pelvic floor. So if I sit like this, I'm bringing my organs, my reproductive organs, from the front of the body more into the back of the body, and putting a lot of pressure down on my pelvic floor. As opposed to if I sit up tall and I let my pubic bone move down and I arch my lower back, my organs are coming forward. It's possible to overdo that direction for sure, but I don't think most people do. I think most people have more of a flat back, with some exceptions. Questions about that? Yes?
Well, I know it's more common, or maybe I'm wrong, for women to have an anterior pelvic tilt based on just our anatomy and the way that our bodies are, and for men to have more of a posterior.
Yeah. So there is.
Is it because our organs are internal organs?
It's because of our internal organs, right? We have more weight to carry, but it's also because of childbearing. So we have to be able to give birth to babies, even if you're not going to give birth to a baby. Your anatomy is such that you could. So when we are in an anterior tilt, you're opening up your pelvis. We've talked about this before, but it does create less stabilization through your sacroiliac joint. And so it is true that a female pelvis is not only more squat, right? It's wider and it's more squat, but it's also more anteriorly tilted. And so the pubic bone is lower than the sacroiliac joint in a female pelvis than in a male pelvis, right? But men still have a firm in their lumbar spine. And Judith Lassiter, who's a great, have you heard of her? She's a wonderful Iyengar teacher, and she's a physical therapist, and she teaches about pregnancy, and she also teaches anatomy. She said, and I think that there's a lot to this, that in all her years of teaching yoga, she doesn't think she's ever come across someone with a truly overarched low back or lordosis, that it's way overdiagnosed in yoga, and I think that that's true, right? So I think that I think there's a bias against the female pelvis in yoga, and so we are sometimes taking pelvises that are correct and we're putting them into a tucked position and putting more pressure down on the pelvic floor, which is especially not good for women because we have more weight that the pelvic floor has to withstand. And then when you add pregnancy onto that, of course,
So you might use the Q like lengthening the tailbone.
I do use the Q.
So space and all that.
Yeah, I do use that cue, especially during back bending,
Yeah.
when it's particularly important.
Cobra.
It's very important in back bending because, well, for all the reasons that you know that it's important in back bending. But the thing with that cue is it has to be balanced with the opposite action, right? So it's not just lengthening down through the tailbone, right? If you're in Tadasana, we'll talk about Tadasana since that's what we've been talking about. The opposite action of that is to descend down through the pubic bone. So it's a matter of relationship between those two actions, right? And it's tricky. I think this is tricky. Like, how much do you descend down through the pubic bone? How much do you descend down through the tailbone? Well, it depends on your beginning point and where is your ending point. And that relationship, I think, is different for different people. So for some, there's going to be more of an anterior tilt in the pelvis, and for some, there's going to be less. And I think there's a degree to which you can kind of move your pelvis. We're not just fixed statues. And so we can move our pelvis, and there's a range that's all correct. You know, right? So like, there's a range in which you can move, and it would all be within a perfectly healthy range of motion. And so we have to be really careful with pregnant women especially pregnant women, not to take that pelvic tilt away from them, because they need that to keep the baby in the front of the pelvis so that the baby can have room to get into a good position and to keep the weight over the pubic bone. But in postpartum women, it is also important because it is what is healthy for their low backs, right? Yeah. The thing that's hard though is that, and right now we're gonna go through a series that does a lot of abdominal work, and in order to engage the transverse abs, you'll find that we're gonna scoop and pull in and scoop out the belly, and it's hard to maintain that lumbar curve when you are doing abdominal work. It's very, very tricky to do that. And so sometimes for brand new beginners, I might have them go a little bit more into that lengthening of the tailbone down so that they can have access to the transverse abs. But as they become stronger and better at listening to your cues and being able to incorporate those cues into their bodies, eventually we do want to do our abdominal work with the lumbar arch maintained.
One of the things when I teach in Pilates, because everything, it used to be all top.
Yep.
And now it's transitioned.
It's changed. Things are changing.
And one of the cues, because it's really hard when I teach classes and you work with neutral spine, just laying down on your back with the knees bent like this.
Yeah.
Is you know you're doing it correctly if you have the multifidus muscle and the low back firing. So you have that
Yeah.
you'll feel the arch, or to keep one hand